We need to recognize in the United States today that although we now have indications for CAR T cells for second-line therapy and for advanced therapy for diffuse large B-cell lymphoma, there's a number of patients who are not getting these treatments. One, because lack of access. Now, lack of access is one, that the referring physician doesn't understand or doesn't know about the indication, and we're dealing with that through intensive education through the American Society of Hematology, American Society of Transplant and Cellular Therapy. But the other one is to make it easier for the referring physician to connect with the cell therapy center and be able to get that patient there. Today, in the meeting in SOHO, the Leukemia Lymphoma Society had a very good interactive session where we met with cell therapists and referring physicians, and we discussed what the misperceptions were. One, many people think that this is, a last-ditch effort, which is no longer. It's been indicated for second-line therapy. Two, that it's a very expensive therapy. There's a lot of resources available for this. Three, that it's a very toxic therapy. We've learned how to manage the toxicities, and most of the toxicities are managed in the cell therapy center. So we think that by educating and by creating an easy connection and enhancing communication between the community oncologists and the cell therapy centers, we'll be able to improve access to these therapies. And eventually there'll be off-the-shelf products in which it'll be even easier to do because you won't have the manufacturing issues.